Welcome back. As politicians battle for health care reform in Washington, the debate hits home for one Fargo cancer survivor.
Cindy Shawcross knows what it means not to have insurance and what impact that will have on her wallet, her family, and her health. Reporter Shayna Sager has more in tonight's Fox Focus.
9 years ago, she was a paralegal in Fargo. But now, Cindy Shawcross's life revolves around payment arrangements and promises.
I shouldn't be up to my eyeballs in debt because I got sick.
The 38-year-old mother of two has had a string of health problems that have left her with nearly nothing. After declaring bankruptcy, she was diagnosed with thyroid cancer in 2007. And while she survived that, she now endures back injuries from a hit-and-run accident in July.
When you have such a huge pile of bills to crawl out from under, you think, you know, is this going to take me 5 years? Is it going to take me 10 years? Will I ever be able to buy a house?
Shawcross received health insurance as a paralegal, but when she left that job, she lost that luxury. She began covering herself on COBRA during her cancer treatments, but couldn't afford to do so after losing her new job at a Fargo technology company.
What wasn't lost in the stock market crash, I pulled out of my savings and I pulled out of my retirement account to cover myself. When I ran out of money, people in the community gave it to me.
Shawcross hasn't worked in months due to back pain from her accident, so the ends just aren't meeting.
It's like opening a box of Cracker Jacks when I go to the mailbox. I just never know what new bill, judgment, legal action.
And that pile keeps growing, as do the frustrations and worries of the whole family. Cindy's husband, Russell Shawcross, works at a local homeless shelter and is not offered health insurance.
I basically sleep, work, eat, practice guitar. That's like the sum total of my life at this point. I don't do anything. I can't afford to. And the less I do, the more money there is for other people.
But there still isn't enough money for an ultrasound or mammogram to see if Shawcross's cancer has spread.
I always worry, like how big it's getting if it were there, and how much longer it could take before it got crazy and it would just be too late.
But her situation has changed slightly, and Shawcross has faith the system will too. In October, she was accepted under Medicaid for 3 months, an embarrassment for a woman who's been working since she was 11, and a relief for a mother who wants to be healthy.
That's all we're talking about, living and dying. And all I want to do is to be able to live and to be able to do so healthy.
Shayna Sager, Fox News.
Shawcross's doctor recently said it's okay for her to begin working. She is now looking for a job.